Okay, good evening. I'm Anita Peter, and today we are here with a discussion about mental health. I would like to introduce the moderator for this evening. He's Mr. Hari Mohan, and Hari Mohan has made a name for himself in the field that he specializes in as a first class cricketer representing Hyderabad. At the same time, he has authored 4 books, two non-fiction and two novels. So he's got a lot of experiencing in moderating several events and a lovely person to speak to. I've just had a short interaction with him, but with that, I know that he's an amazing, a gem of a person. And I welcome Hari Mohan to take it from here. Thank you very much, Hari. Yeah.
Thank you, Anita. So let me introduce the co-panelists today for the discussion. So the discussion is on mental health, and this discussion is titled "Stay Alive, Being There Matters." So it's centered around the book written by Anita on how she dealt with depression. Her book, of course, is titled "To Win Your Battles, Stay Alive," and this is the book. I'm sure Anita will show the copy again. So apart from Anita, of course, I mean, for those who don't know about her, she's a much accomplished person, Mohini Atom dancer, runs a dance school. She's a biker. She's traveled Kanyakumari to Kashmir on her Harley. She's a TEDx speaker, a leadership coach, teacher. She's an actor, director. I've seen her short films based on this. And now perhaps her most impactful role, I think that of an author, having written this book. Then we have with us Vijay Lokapally, a dear friend of mine. He's one of India's senior most and most respected journalists. Though he specializes mostly in sports, he also writes about literature, films, and in the cricket fields, I don't know if any journalist commands as much respect as he does in the contemporary list. He spent a lot of his time with the Hindu. He's written several books, including one on Virat Kohli, one on Rohit Sharma, fast bowling, and other books. He's also been on held very important positions involved in the development of sport in India, and he's with us today. We have Gayatri Sridharan from Delhi, an applied anthropologist. I was talking to her yesterday. Of course, I don't know what anthropology means. Then she explained to me it's something to do with human behavior. And she manages her own boutique firm called Anthropy. It's a lovely name. I don't seem right. It never seems to go out of my head. More on that later. Then, of course, we have Anand Narayan as a counseling psychologist who's volunteered for 20 years with Roshni. That's an NGO that offers a helpline for the distressed, depressed, and suicidal. Have taken off their website and offers counseling service and emotional support for psychiatric issues. And to complete the panel, we have Dr. Siddharth Reddy, who is an MD in psychiatry, consultant psychiatrist, and a psychotherapist. And of course, I would like to know what's the difference between these two later on. Fine. So this is the panel we have today. And as I see it, I don't seem to have much to moderate because there's a lot of experience and expertise here. So, but to begin the discussion, we'll begin with Anita, because her book, To Win Your Battle, Stay Alive, is the reason why we're all here. So firstly, congratulations, Anita, on writing your book and publishing it. You know, it's a wonderful, timely, well-structured, accessible, and I suppose very helpful book. And you know, that helps us deal with mental disturbances, as you call them. As far as the 4 books that I've written, I know how difficult it is to write books, fiction, fictional books or short stories, but to write something which is deeply personal and make it useful to society, that must have been some experience. So I congratulate you first. And then, of course, the logical question, why did you write the book? What compelled you to write this book? And what is the purpose behind putting your thoughts into this book?
Okay, thank you very much, Hari, for the for whatever you have said. It's very kind of you. And to quickly tell you as to why I wrote this book, I've been through clinical depression thrice. Okay, the first time I did not know it was clinical depression, and I've also been, I would say, exposed to the social taboos, the stigma, the mindset, and the attitudes that people have towards mental health, mental ailments, and also towards one person who is going through all this, because they are considered as weak. Sometimes they are considered as nutcases, mad, drama queens, somebody who's trying to seek attention, etc., etc. So there are a lot of feathers that come on your head, when you are going through mental ailments. But
Right.
what I today that I've come out of all the, the third time is when recovery and healing has happened for me. I feel that I've been lucky to go through it thrice, I would say, even though I said, why me, once upon a time. Today, I know that thank God it was me, because I'm able to bring this out with the help of fantastic people who support me today, as all of you. And I think to make a difference, there should be people who are strong and who can speak out like us. So I'm grateful for that. So the reason I've written this book is there were a lot of fears that I had, lot of
Right.
kind of things that I have faced. So I wanted to be like, I've been crazy to try and get self-help books, try to speak to somebody, who can I trust, a lot of questions. What is
Okay.
a psychiatrist, who is a counselor, what is psychologist, so many questions, and why do I have to go to them, does it mean I'm weak, what do people think, these are the questions.
Right.
So if there is one platform or something where these answers are there without personal stories, okay,
Right.
so then it would be really nice. And that is why I wrote this book, because it is a battle, end of the day, to go through it, recover, heal, and come out of it. And the only thing that you need to do is to stay alive, because several times you feel like giving up. And if you do not give up and come through it and meet the right people who can bring you out, I think you will emerge as a stronger person who can give back to society. And that's the only reason I've written the book, for other people.
Right. To Vijay. And Vijay has also written about how he coped with depression. I mean, he's had a high-profile, stressful job as a journalist, sports journalist, um, throughout his career. And he wrote a very sensitive piece in the Hindu in October. I read that, and he talks about how he's always had this sadness within him, and it was only much later that he went to a doctor that he was diagnosed with severe acute depression. Your thoughts, Vijay, your experiences on what you went through, what are the difficulties you faced? Yeah.
Thank you, Hari, and thank you, Anita. To begin with, I would, if I'm here on this platform discussing this very sensitive subject, the credit entirely goes to my friend Sonalini Matthew from the Hindu, because if that story which you read was only because she encouraged me to write it, and I thank you, Sonalini, for this wonderful effort. And then, of course, connecting with Anita because of my friend Sunny and Gayatri and all the wonderful people here. I was, for many years, I didn't realize that it is a condition which has to be dealt with very by professional, with some professional help. And I tried to stay within myself. And now I realize that I tried to stay alive actually, whatever I was doing. And today I get a lot of strength. And for everyone here who is affected with this or impacted or going through a difficult period, there are two wonderful books, one by Anita, and this one was recommended by Sunalini. So I will ask everyone to read this book. and I've already told Gayatri also. So my experience has been very tough, Hari, but I have been very fortunate to have a wonderful family support. They have suffered my mood swings and, have suffered my very odd behavior at times. My friends, I have some very good friends who have understood me. So this has been my experience. It's very difficult. Very few people understand us. When you go to them for help, they think he's only trying to gain attention. It is not actually gaining attention. You are just seeking help as on an individual level or in a group. So this is what I have to share. And once again, I would like to thank Sonalini. She was the one who encouraged me to share my stories, which has connected me with you lovely people.
Right. Thank you. Thank you, Vijay. We'll come back to you again. And I'll head straight to Gayatri, who's a young professional anthropologist. We spoke about your condition yesterday. You spoke about bipolar disorder, and you said in the West it's considered a disability, right?
Yeah,
Right.
strange disability for me.
You just take it from here. Your experience with how you cope with this. What were the difficulties you faced? What did you expect from society or people around you? How was it for you?
Okay, so I was diagnosed with clinical depression at the age of 20. And I think it was, even though it was just like in the early 2000s, it wasn't that long ago. Even back then, there wasn't really there was a vocabulary against, within a particular group of people, that is, people who practice psychology or psychiatry. They understood what it meant to be clinically depressed, the idea that there is a chemical imbalance in the brain that is causing this level of mood swings and behavior issues.
Right.
But at that time, medication was not recommended to me, and I didn't follow up with, honestly speaking, the therapist that I started seeing at that time caused me a lot more grief than, than she didn't exactly facilitate a healing process. I remember a particularly difficult session where she called my parents in, and in effect, I mean, they were already sort of reeling from this announcement that, oh, your daughter, your young 20-year-old daughter who has everything she could possibly want in life, she's clinically depressed. And then she sort of dragged them into her office and kind of set the cat amongst the pigeons for them. It was a very difficult experience at that time. So for time, none of us really revisited the conversation around depression again. It was in 2011, 2012 that I started seeing a therapist who was not only trained, but was an experienced experienced practitioner of empathy.
Okay.
That is the key thing. And I find that what I've learned from my journey, Hari sir, is that you find whether it's your therapist or whether it's your psychiatrist or whether it's a parent or a relative or a friend, if you have someone, and Vijay sir, you were talking about this with me, if you have someone who has the ability to listen to you with empathy and to listen, to pick up on nuances that maybe you also don't know lie in what you're saying or doing, I think that that can go a long way to, that can go a long way in your recovery, in your healing. Somebody who just says it's okay to be depressed and it's not a big deal. You're not any way different from the next person. That said, you talked about the bipolar disorder. So I was diagnosed in 2018. That took a little while to sort of get used to as well. And then in 2019, I was applying. Somebody had sent me an application process for a grant or something, for a job or something. And it was in the UK.
Okay.
And I answered all these personal questions. And then one of the questions was, would you be categorized as disabled? And then I looked through their categories, and depression and bipolar disorder count as disabilities. So that has left me sort of thinking about, am I disabled in some way? Should I be, as I grow older, as the disease progresses, will stop me from being completely functional? It's also made me question my existing levels of ability, and to think of ourselves as, I've realized that to think of ourselves as completely, wholly, perfectly abled, completely equipped, this is the burden that adults carry, particularly. To think that way it's fallacious. We need to sort of measure our individual disabilities. You don't need a certificate for it, but we definitely need to think about where each of us, depressed or not, bipolar disorder or not, have issues or impediments that stop us from completing completing an action or completing a task that we want to complete. That is something. So basically, my journey has kind of led me to this realization.
Mm-hmm. Right. Thank you so much. It appears from whatever you've said, this is a very lonely journey. You've got to figure it out for yourself, and we do look for people with empathy, who look with gentle, who sensitive, compassionate, who understand this condition. I'll ask Anand, who's been a counseling psychologist and who's volunteered with Roshni for about 20 years. I'm assuming that that would be the first stop beyond your friends and family that you'd go to a counselor. We can clarify that as we go forward. But at what stage, does somebody reach out to a counselor, and what can they expect? At what stage do they reach out to someone, and how do you find a counselor? How do you find a good one?
Yeah, thank you, Hari. Yes, my perspective is from the work that we do at Roshni, and we provide the emotional support that people need. So very often we find that we don't have the internal compass that can guide us through our journey, and we do need to rely on someone or the other. And it happens to almost everyone in their lives. Sometime or the other, they need to depend upon somebody as to guide them.
Right.
Unfortunately, not all of us have access to such a person.
Right.
Very often, the issues that we are going through are such that we cannot talk to anyone about it.
Right.
Sometimes it may be that we are not absolutely sure as to whether this person who I talk to, can I trust them wholeheartedly?
Right.
Would they really understand me? Because this is a very key factor that most people who are depressed or in a state of an emotional low, people don't understand them. If somebody is in severe depression and they go to a friend or a parent, very often they are told, "Hey, come on, get a grip on yourself. Just get going. I mean, start living. Like, what's wrong with you?" And that is the most difficult thing for them to do. Somebody in depression just cannot, just get up and get going. They can't even go and have a bath, let alone sometimes, So it's very, very difficult. And that is where the need for understanding comes in. We need to understand the other person, and that's where empathy comes in. So that is somebody who is, really in a troubled state. Then there are others who are troubled, but because of the situation that they are in, because of their circumstances, they need to put on a facade. They need to put on a face and kind of pretend that everything is okay with them. And actually, it's not. Sometimes professionally, we've got to put on a face, whereas actually, internally, we are really hurting. So this is where people need that support. They need either family, friends, or organizations who can just accept them for who they are and help them go through that process. So now, what is this helping them go through? See, very often, many of the people who need that help may not be clinically depressed.
Right.
They may not be in a state where there is neurochemical imbalance or hormonal imbalance which needs correction. They probably just need understanding, a certain amount of change of cognitive thought processes, the way one thinks, their attitudes, behaviors. Those things need to be modified. But then again, you need help.
Right.
Sometimes you are so down that unless you have that little bit of medication, you can't even reach a stage when you can begin to start dealing with your internal self. So this is how the kind of situation people are faced with.
Right.
To your question, where can they find help? There are numerous things, and that's, I think, one of the objectives of this kind of a discussion is how can we make that help available to more and more people? How can we remove the social taboo that you're a mental case kind of thing? How do we do that? And,
right.
We can.
Yeah. So I will come back to the second part of the question later. I'll address this to. So again, Dr. Siddharth, when should someone, seek medical help? What stage do they need to seek medical help? What are the signs? And what are the common mistakes that people do? By let's say ignoring things until it's too late, or how do we go about this? When exactly do they need to seek medical help?
Come out. So coming to your question as to when do we seek help? Okay,
Right.
As soon as possible.
Right.
For example, like Mr. Anand sir said, not all issues need medications. Yes, that's true. There are certain forms of illnesses in the starting stages, like depression in the starting stages, don't need medications. Even anywhere in the Western world, you see, they start with therapy, counseling. I would like to use the word therapy for scientific prominence. Therapy, which actually helps them a lot.
Right.
But what happens is that in India, where not just in India, let me say there are countries like China, Malaysia, Bangladesh, where also mental health taboos are actually existing. They let it go, and they let it progress to such a stage where at the end they require, what should I say, extensive medical aggressive treatment, which includes medications, injectables, and some other form of procedures. So what happens is that, so like as you asked, what are the starting symptoms? See, the most common starting symptoms, anybody, even the family members, which they can see, are actually, they will observe that the patient is actually talking less, they're withdrawn.
Okay.
More than that, they would notice that he's not eating. The appetite in any of the mental illnesses, if you'll see the true mental illnesses, the appetite falls down irrespective of the cause. And the other thing is the sleep disturbance.
Okay.
They would start complaining that I'm either waking up earlier than usual, or I'm getting a lot of taking a lot of time to fall asleep, or I'm getting up multiple times even after falling asleep. I'm not feeling fresh. So these are the starting complaints which they would complain of. The other thing would be that they would become more irritable than usual. Many of these family members, they would say, sir, in the start, when I would ask them details, how did it start, to look for the starting point when the illness start, they would say that, sir, initially was a very good guy, but since 6 or 7 months, I'm seeing that he's becoming angry or irritable for no other reason. So my aim is that you should, bring the patient should as soon as possible, because we have to nip this in the starting itself. Otherwise, it would lead to all sorts of severe complications, and that is where the true disability comes, not in the starting stages. So so I would say that they should bring them in the starting itself, actually.
Right. Okay. I'll go back to Anita. Anita, you in the book, you mentioned about this entire support system of counselor, psychotherapist, psychologist, and you've differentiated between them and a psychiatrist, and at what stage one can go to which person. How did you go about it? What has been your experience? And how would you advise anyone to go about it? Because I don't understand these terms. Everything looks the same to me almost. And I don't know who can prescribe medicines, who can help me, who can, I don't know, you can guide me through that.
Absolutely. This is one question that everybody has. But let me also say, like today I was sharing it with another group, that every human being, or if you're a human, you will go through some kind of a mental disturbance at any point of time in your life. Now, it is, now as the, the mental disturbance, if it's not taken care of, it grows into a serious, like how Dr. Siddharth has said, if you ignore it, and if you are in a state of denial, that's when it goes really bad. In some cases it's a genetic disorder. I'm not a medical expert, but this is what I have understood from a lot of discussions. But as far as I know, 30% of the people, they currently are aware of the fact that we do have a medical issue, and we are in a situation where need some kind of a professional help. 60% of the people are in a state of denial most of the time, that it's difficult, I know I'm going through this issue. Immediately they go into a shell, they take out their frustration of over another person. 60% of these people are people who make the lives of others hell, because they are in a state of denial or acceptance. And in the bargain, the other people go through a mental mind disturbance, as I say. So it's like a vicious circle. And 10% of the people are lying about it. Oh, nothing is wrong, nothing is wrong. So most of the time it is like that. Now, when I would say everything is not a mind disturbance or a mental disturbance, there are situations where it is a slight difficulty that you're going through. That's a normal emotion that we go through. Now, if I have a difficult relationship, you can't expect me to be happy about it. It will start affecting if my boss is really making my life hell, or my work, I'm finding it difficult to balance my work and life and my relationships and all, it's natural for me to feel irritable and difficult. So these are situations where probably I need to speak to somebody who has a particular method of listening without biases and personal experiences of I think you're a woman, then you might as well forget your work and sit at home. If I was in your place, this is what I'll do. So not to a person like that, not with personal biases. So that's not the kind. So that is where professionalism comes into the picture, where a person who can listen and guide you without biases, knows the method of how to listen and how to give suggestions, is, I think, counseling, because they have to go through the studies are there, qualification is there, internship is there, they also need to register. Psychologist, as far as I understand, is a person who goes on a higher level of studies, where they also go into therapy and clinical psychology and branch out, and it's and a psychiatrist is a medical doctor, which people don't understand. Okay, because I always say they look at every doctor without anything. Psychiatrists, oh no, it's like that. No, like I say, poor doctors, they study medicine, they are doctors. Please give them that benefit that they are doctors. So these are the different kind of categories that we have, and people need to understand these are professionals here. Now when do you see? For me, a normal sadness, I can possibly go and talk to a friend and try to feel better. I can try and distract myself. However, if that disturbance is affecting my quality of life, bringing in fatigue, bringing in disconnect. It's rightfully said by Vijay sir, which I didn't mention. You feel, I call it a disconnect. You're going to do something, but you can't relate to anything. A disconnect happens, and you become. In my case, I was overeating actually. My appetite. I was overeating because I was really sad. I was putting on weight, and because I was putting on weight, I was even more sad. So it was like a cycle. To feel better, I'm eating junk food, I'm putting on weight, and because I'm putting on, I'm feeling worse again. Again, I'm feeling worse, again I eat more. So it was like a cycle in my case. So in that time when even bathing becomes an issue and normal routine stuff becomes an issue, and no matter how much you try, it's not because of laziness. People think you're lazy. It's not that. You're just not able to. That's when you need to look for professional help. You need help. Go to professionals.
Right. Yeah, quite illuminating. You went to professionals, and you at different stages, you had 3 bouts of depression. The first one, you didn't know what to do. The second one, you got a lot of homegrown advice. There's a lot of fear about psychiatrists. And you mentioned in the book how the first visual that we get is what we see in the movies, these guys giving electric shocks, and then you're done for. Right? And the third time you said you'd gone to a psychiatrist and that helped you heal. Vijay, you kind of seem to have handled it alone by yourself and with your own support system at home. Would that be true? And how did you go about that?
I think I was my best friend, because I've written in the story, I would avoid people suddenly, and they would often mistake me. I mean, they misunderstood me. They thought I was so arrogant that I was not willing to converse with them in a public place. And then I felt, I don't know, Sonalini, when I wrote the story, she said, "Oh, very brave of you." I think was I a coward all my life? I mean, not wanting to, just keeping it to myself. So one of you I would love to know if I was not a brave man to have kept all these my problems to myself. But yes, I would love to hear from Anand sir and Dr. Reddy, that was it an issue if if I kept my problems to myself. I loved sadness. That's what I've written, and I would love to be a sad man. That made me happy. Very funny thing to say, that being sad made me happy. And I would certainly, I would have a disconnect with people. I would struggle to write an article which I would have written in a jiffy. There were times when I would just walk out alone on tours, quietly in the night, because I thought I was always very comfortable with strangers, because I thought he is not going to judge me. And even if he judges, I'm not going to meet him again. He's a stranger. So I would love strangers, striking conversations with people I didn't know, in a train, at airports, or in restaurants, or wherever, at the cricket grounds. I've made many people. I spoke to them as if I've known them for many years, but I've never spoken to them after that. So it's been a very strange journey. Very few people understood me, but my family, yes, they have. I know they have uh, suffered somebody who behaves very oddly at times, and I'm also grateful to some of my friends. But my impression, my experience, Hari, is that people who have this condition, often I feel, and my own experience is that I'm safer when I'm alone. I'm with myself, and I don't know if that is the right thing to do.
Okay. Dr. Siddharth, Anand, you can answer that. Is that the right thing to do, to be alone? Because I remember reading in Anita's book, don't leave them alone. What would you suggest?
I would suggest the same thing, that it's better to not to leave them alone as it is. But not leaving them alone doesn't mean to continuously pester them with questions as to what is going on, what is happening, what is it. It just even sitting next to them, quiet, and just ask, it's an empathetic way of questioning. What is
Right.
happening? Are you okay? Many a times the what happens is that it is not the question we put forward, but the way it is put forward. Like, see, it's the very different, two different things. For example, hey, what's happening? Are you feeling okay? Hey, you are okay. So things like that, rather than telling, many of these mistakes which many people do to people who are suffering from, mental illness, is that you are lucky, you have everything else, you should think about those people who don't have those issues. So statements like this actually aggravate them.
Right.
So the thing is, it's not about leaving them, it's not about giving them company, it's about giving them the empathetic and the right company.
Right.
So rather, if even if you sit with them and you pester them, it actually worsens their condition, and equally, scars their psyche.
Right.
And coming to the question that you a coward, I would say no. It's just that you were a confused state, and many people go through the same thing. Am I confused? And that confusion is, many people face it actually. And if you'll see many of these people, they rather, the reason for them being is that they don't want to hurt their close friends by by revealing their own things. They would rather keep them happy by keeping us a happy face, happy mask, and make sure they are not hurt, so that they can be happy with whatever they are. But that mask sometimes breaks off, and it causes actually a more harm to their family rather than keeping them happy.
Mm. And Anand, this thing about sadness that Vijay spoke, what do you think? I mean, do you think it's okay to be sad? Do you think so? Vijay seems to be quite happy being sad.
Sadness is a part of everybody's life. There are situations when almost everyone is sad, and there are circumstances where it's only right that one is sad. But I'm not sure as to what it means to kind of be happy in sadness. I really didn't understand, Vijay, when you said that. I didn't quite grasp that. But what I'm kind of understanding is that there are natures. Every individual has their own kind of a makeup. Some people are naturally more kind of effervescent and outgoing. Others are more inward directed. So it's a very wide mix of personalities. And but talking about sadness, yes, and it is when there is a persistent sadness that extends over several weeks or months. Now that is not a natural thing. We all have periods of sadness every day, or moments of sadness because of circumstances. But to be sad over an extended period of time, that is one of the markers that we say, all right, this shows that there is something quite not ordinary. And whether it requires medication as a form of treatment, that is something that the psychiatrist would it's in their purview to decide. But very often some of these things are either learned behaviors, attitudes, wrong thought processes, or cognitive errors, as we call it. These are what a therapist can help one get over by just changing the way we think, and as a result, the way we act and feel. So not everything needs a medication, as we talked about earlier. That is, but what all these conditions do require is understanding from someone else. And that someone else may need to be a family member, they could be a friend, but whoever, we need to have conversations we cannot be interrogating. We can't go on pestering them with questions, and because that interrogation always has a kind of an accusative tone to it, that's not what is required. It's like, how are you feeling? Like, would you like to tell me about, what you're going through? That is a technique that all therapists, counselors, and trained professionals will adopt. So how you talk to the person, which is a very important thing. And very often friends, even though they are, very well-meaning and good intentioned, do not always ask us the right questions or talk to us in the right way, thereby putting us off. And then, we kind of close up, go into a shell, and that causes further damage.
Okay, that's very interesting. Gayatri, you the support system. Initially, the support system seems to be an important thing to have, right? And if you don't have people who understand, it seems to aggravate this situation. What are your thoughts on how did you? What is the kind of support system you had? What did you expect the ideal support system to be? What would you like it to be? And was there anything from your experience that you can share, which you could have done right, or which would have been right way to go about?
You know what? The question, what is the ideal support system, and what should it have been for me, or what could it be for me? I mean, of course, if you ask me in a few years, I could change my answer again. But at this moment, and especially given the experience of COVID and having spent a lot of time indoors, I've got to share with you the idea that I've actually done better alone in the last year, without a flatmate, without parents. So my father lives in Hyderabad actually, and of course everybody in my family is above a particular age and therefore vulnerable to COVID, so I couldn't visit them. But I did fairly well actually by being alone, because I feel like I feel like sadness and being alone are kind of underrated. Sadness has its therapeutic has therapeutic aspects to it. Loneliness or being alone, being secluded, being reserved, there are therapeutic aspects to it.
I'll go back to Anita until Gayatri comes back. So Anita, and it's an extension of what we were talking now. And in your book, of course, you wrote something about these vultures who are around us. You also spoke about this beautiful concept of this priority circles, where you prioritize who is around you and the kind of people who are around you. It's very important, obviously, to keep the right kind of people around you and put the others away in what we call the black hole.
Yes.
Right?
Yes.
So elucidate more on that, because that seems to be very interesting. I mean, I'm sure everyone can benefit with that, because all of us have vultures in our lives. And yeah, I'm sure it's going to help. Can you just throw some light?
So as we are talking about the support system that is required, it is very important for any human being to have that one go-to person, at least in life. In our culture, in our concept, we call that as husband or wife or companion or anything like that. But sometimes it need not be that it is your spouse who could be that go-to person. It also doesn't mean that a go-to person means an extramarital affair or something like that. It is not about love or lust or sex. It is not about that. A go-to person is a person who you can speak to, who is not judgmental, and who is not going to find opportunity in your weakness or your naiveness or your innocence. That is a go-to person. So it is very important that each one of us have such a person in our lives. Support system, it is very important for either the family or the person who is in close proximity to understand that the other person is not doing so well with regard to their mind at this moment, or mental disturbance or mental state. Now, what happens is the first question that comes into everyone's mind is, what will the other person think if they know this about me? So that is a stage, and because that social taboo and social stigma is so high, there is a vulture out there, as I call. Because if I am seen as a person who is weak, and if I'm going to be affected by the fact that, and I'm hiding that, there is a person, probable person who could be there. I have come across two people like that in my life who saw that I was going through depression, but they did not let me know that they knew I was going through depression. They just came to let me know that I'm there for you. But both of them came in, one is a man and the other is a woman, where they had other things on their agenda. And most of what they have in their agenda is something that will take a part of you away. And when you are going through a difficult situation, it pulls you all the more down. Now, this can happen, as Gayatri had earlier said, it can also happen sometimes, we think that the go-to person will be a therapist or a counselor or a doctor. Sometimes even a counselor, doctor, or a therapist can put you down big time. That is why it is very important to choose who you go to. I've been to a counselor, a pathetic counselor, who, in fact, because I was also doing a lot in my life at that point of time, still going through depression, I had my own reasons, and which is not the most important thing here. Okay, that is my personal space. But I had my reasons that were my trigger points in the reasons I went through whatever I went through. So what his suggestion was, you need to understand that you are a woman. End of the day, a woman should not dream too much. And it is something that you have to, your problem is that you are not in an acceptance of the fact that you are a woman. Okay, that was what he suggested to me. That was like as if I was hit on my head with a hammer, because in a conservative society, they will say what is wrong in what he said. But we are not living in a society of going back. I think we were more, when we're talking about feminism, does not speak gender. It is about a respect of capability and ability. If I'm capable of something, why not? I do. So here I had a counselor who proclaims himself to be a psychologist, a doctor, because he's taken his PhD, telling people that. And then I came across several other women who were told this by him. You understood? So he is a vulture who was thriving on, I would say he was so, dominating, and that male power, he loved it when his patients or clients were feeling so low, and he would then say that, no, I'm there for you. All right, ting, ting. Now, so what happens is, these are people. Now, then the question is, whom do you trust? That is why I came up with a priority circle. Priority circle is a circle which I'm not going in depth. It's there in the book very clearly. It helps you to categorize and also prioritize as to what is, you understand what is your personal space, you understand what is making you uncomfortable. At the same time, you know when to say no, because you place people where they belong. Now, just because you know 1,000 people or 2,000 people, you don't have to get all the 2,000 close to you. Even if it's your own father, if he is making you feel uncomfortable, you can place him away from you to a certain extent. And only once you understand that circle, you will know. You don't have to go and tell them, oh, you are in priority circle 30. You don't have to go and tell them that. It's something that you plan in your mind and you're working out in your mind. So the further you place them, your behavior or the way you look at them is with more in a formal way, more professional way, and you know where to place them. Your expectation reduces. You know, this is all I'm talking to you for. Bas, you don't have to tell them. So it is not based on hatred or anger or anything like that. There are some people who have to go to the black hole. The black hole is one, I would say, it is so far away from you. I have thrown one very prominent person in my life into the black hole. Okay. And so I've thrown that person there. Now, when they are thrown into the black hole, I don't even have to call her and say, you know what, I put you in the black hole. I don't have to tell her that. But when I see her, I say, oh, this is the one from the black hole, very far away from me. So the distance that I have to travel to the black hole is so far, time consuming and energy consuming. So I'm not going to invest my time in conversation or clarification there, because there the expiry is over. She's in the black hole. You understood. So again, it's not based on anger, hatred. It's only about you being a better person each day. And every day I tell myself, today I will be better than what I was yesterday. Or what could I do better than what I did yesterday? These are the two things. So those were the significant things I spoke about in the book.
Wonderful. That's very nice. Gayatri, you can go ahead now and complete what you're saying. If you remember what you're saying. Yeah.
I would like to. I have a feeling Anita ma'am's dog started barking the minute she started talking about priority circle. They were like, hey, "We are a part of that priority circle. Give us our voice, man." But no, I think that I did, coming back to the point of being alone, being sad, I do appreciate the qualities that one is endowed with. I think that my being diagnosed with clinical depression and then bipolar disorder have been a blessing for me. It's an opportunity. So now I kind of, by now I know that there are certain parts of the year that I'm really productive. And there are actually issues with that as well, because I tend to go overboard. My biggest trigger in my life has been work performance and creating original work. So it's a good thing, it's my driving force, but it can also push me over the manic edge and make me additionally tired. But on the flip side, so during my depressive phase last year, I started painting again. And I felt like I found a little bit of my self-esteem in that process again. I just want to talk about one other thing that Anita ma'am just said. First of all, I cannot believe you had this experience, and I'm so sorry that you had this experience. There was actually someone who was talking to you like that. I will say this, that I think that there was a time that, therapists were a lot less under scrutiny. Therapists, clinical psychologists, they're a lot more now. And there is such a thing for anybody who is listening. And if you feel like you want to talk to somebody about their condition, there is such a thing as therapist shopping. Therapists themselves will tell you there is such a thing as therapist shopping. You, just the way you go from, you do window shopping, you go from one to the other, because different therapists, different psychologists will employ different approaches. They are, at the end of the day, academically grounded as well. So some of them are trained in cognitive behavioral therapy, some are trained in psychoanalysis, and it's just irrespective of whether they're you are entitled as someone who consumes their service. You are entitled to move from one therapist to the other. You could have a very good experience professionally with a therapist, but because you're bearing your soul in a room in a closed room, if you feel like you don't have a rapport after 3 or 4 sessions, it is perfectly all right for you to set up an appointment with someone else. It's good practice. It's best practice to when you say, all right, I want to get a therapist's opinion, just the way you would do with a cardiologist or with a surgeon, or if you're going in for surgery, you would check into the credentials of your doctor, right? Of course, you respect their professionalism, but you would want to know whether they prefer certain approaches over others. So you are completely within your rights to check their credentials, what approaches they have, test those approaches and see if they work for who you are. Some people do better with cognitive behavioral therapy or dialectical behavioral therapy, and some people do better with psychoanalysis. It's not like one is definitively better than the other. It just depends on what works for you. So yeah.
Well, that's interesting to know. I didn't know that you could do therapist shopping. Yeah. What's interesting, of course, is that this can affect anyone, right? Irrespective of what they do, how old they are. And Anita wrote in her book about how people would say, you got all these going and you seem to have a good life. So how can you talk about mental health condition? And so this obviously can go the whole distance. It starts with feelings of sadness, but it can go up right up to these panic attacks, and you also have these suicidal tendencies, right? So, Anand, I mean, you dealt with, Roshni completely deals with, has a helpline dealing with suicide. And so how do you, how does a person who's, not able to handle the situation, what do they do? I mean, how do they approach you? What's going on in their mind? And
Yeah, so it's my wish that everybody has this priority circle that Anita talked about. It would be great if we all have that very close confidant who we don't have to throw into black holes. Unfortunately, many of us don't. And that is where, somebody like Roshni comes in, where we lend a certain anonymity to the whole experience. The person who calls us doesn't know who we are. We don't ask them who they are. No judgments. So it's a safe environment. So the most important thing that is required for that person who is vulnerable at that stage is a safe environment where they can kind of ventilate their feelings and unburden themselves. Now, that having been said, one probably needs to go beyond that into either therapy or medical intervention, as the case may be. Now, this is usually what we do, is that, of course, these days, people are able to reach us through various means because of the social media and the modern technologies. Access has become pretty easy. In fact, a lot of people who do approach us today, they have this suicidal thought that comes to them, and they go and Google suicide. And that's how the word, the Roshni website pops up, and then they come to us. Some people even say how to commit suicide. They're looking for that, but actually that's not what they want. See, suicide, as we continue to maintain, is not a wish to die. It's a cry for help. And if we don't provide that help at that point of time, that is when the person is, is kind of, takes that ultimate step. So people reach out to us in that way. And having done that, and having kind of ventilated a little bit, unburdened themselves, that burden on their mind is reduced, then clarity emerges. So once you have a certain clarity that this is what I'm going through, you can think of what are the next steps. And we usually give them those options, saying, look, would you like to try? There are therapists available, there are counselors available. We have some of them on in our organization itself, or we could recommend counselors who are outside. Now, you're free to go shopping, as Gayatri said, if you don't get what you want. But that is the next stage, is when you kind of get the clarity that, yes, what I'm going through is something that I need professional help with. What exactly is the professional help is not something that one can decide right away, not in the first interaction. Yeah, usually they talk and they figure out that, yeah, I would probably need to go and see a psychotherapist or a counselor. And if we see that the symptoms are pointing towards a more a more serious nature of mental illness, if there is a psychotic condition and things like that, we would then recommend that they go and see a psychiatrist, which also can be provided. So that's how the progression goes. But the first thing is, you've got to unburden yourself with somebody who you can trust.
Right.
That's the first step. Without that, and then only when that person does that, will he be willing to go to the next stage. You can't drag a person to a therapist. He's got to go willingly. You can probably medicate him, but then it's got to be with consent, and that usually happens only when they have achieved a certain degree of clarity that, yes, this is where I am. This is what I need to do next. Seek help.
Right. Seek help. So calling a helpline is not a bad idea at all.
It's a good idea, if you ask me.
So yeah, that's a good starting point if you don't have people who are empathetic. So Dr. Siddharth, you must have seen enough psychiatric issues. So society, I mean, there's so much talk about empathy, so much talk about understanding, and it's pretty much that there's not too much understanding and empathy out there in society. So generally, and what would you think? I mean, you've seen enough. What exactly is the mental health of our society? I mean, how there are very few of them are reaching out, and there's so many of them. I mean, if you don't seem to have empathy or compassion, or any of these aspects, that also probably reflects on the mental health of others too. What's your thoughts on that?
Well, there recently, like 2 years back, a statistics came that India is the second most depressed nation in the world. And that is the status of mental health of our society. Basically, what happens is that in our society, when anybody comes and says, I am this, they either say, they go back to the cultural aspects, like go back to your cultural thing or religious aspect thing. That actually, helps only to a certain extent. But beyond that it becomes difficult for them to do it, because one of the problem with mental health issue is a loss of concentration and memory disturbances. So in our country, very few people,
Right.
like what we see in my clinic is actually, let's say, only in a day is only 10% of the people who are supposed to come to the clinic or either go to a counselor or psychologist. They rather go to some other person whom they believed, because they go to an elder in the family, or they go to another elder person, a father figure, a motherly figure. Many a times they say, they give advice which suits them, but most of the times when it comes to the real mental health issues, they actually end up worsening it. So that's the issue. For example, a personal experience from a patient, female patient, she developed post-natal depression, that is depression following pregnancy.
Right.
It is a very complicated disorder, and the family members actually, what happened was that, and in our country, the women go to the mother's house post delivery. What happened was that the parents of that patient were actually worsening the condition. They started telling her things like, you're not fit to be a mother, you have to be a mother, what is this, you're not able to take care of the child. They were not able to understand that she was going through some things. But luckily the husband, who was who is more empathetic, more understanding, he understood and brought her, and we were able to save her in the nick of time, because she was contemplating suicide, and because the guilt driven into her by her parents that she was not being a good mother. So the issue in our country is that basically entire country, wherever it is, like you go to north, south, east, west, it's almost the same. The family and the society never understands. And like how Miss Anita said, like it need not even be a father. Many a times the parents themselves actually worsen the condition. You won't believe, I think Mr. Anand sir would be knowing that the family members bring the patient saying that, sir, counsel him. When I tell him he needs medication, he's in that stage where he needs medications, and even if he needs therapy, he requires 6 to 8 sessions. They're like, why, sir, can't you do it in one session? Why medicines, sir? Why can't you do it with this? And they don't understand. Many of them don't understand the severity. Many of times it is the unexpected places where the help comes from.
Right. Interesting. Anita, so we'll take, before we go, let's say, to the stage when you're seeking help, I think one of the things that your book is trying to do, or even this discussion is trying to do, is to probably ease the stigma and taboo around this entire mental health issue. Because there's no mental health, there's no taboo around breaking a leg or contracting some other illness, though there seems to be a lot of taboo around this. So one way to ease this, and probably is a lot of pressure on the individual to do it pretty much on their own to seek help, is to promote conversations, right? And that seems to be a big part of what you are seeing also. Continuously this thing about staying alive or being there or having conversations, or to everybody around you saying, talk to them, right? So what are the initiatives that you want to bring forward? You put in a lot of effort into this book, you put a lot of effort into promoting it. Yeah. So
yes.
Just go ahead.
Yes, Hari. See, one thing is that we all know, I think Anand sir as well as Dr. Siddharth will agree to it, and Vijay and I also. We here now have to have a counselor in your organization or school or college is a mandatory thing. So as much as everybody is keeping a counselor, is the role of a counselor made use of or justified in the organization or anything? Because if I were to, students, they are very scared to go to a counselor, because the minute they go to a counselor and comes back, the first question is, why did you go to a counselor? What you told? People don't understand that what the person discusses with the counselor is a very personal space. So because of this thing, students don't go to a counselor. Then another, actually an MNC, now somebody said, no, we have a counselor on board. So if all our employees, if they have a problem, we have given them the counselor facility is there. So we tell them, don't worry, nobody will come to know. You can dial in secretly. Nobody wants to. Now the fact that you're using the words of secretly, hide and go, this and go, that is only letting people know that the taboo is there. It's okay, Now suppose if a person goes to a counselor and he is diagnosed with clinical depression, or okay, let me say like bipolar, for example. Somebody had spread one of I told you the counselor that she was not a counselor, but she proclaimed to be a counselor, but she said that I'm probably bipolar. Okay, bipolar has testing also. Now she just because Anita, maybe she's bipolar because I'm very energetic. I've got a lot of energy within me and I don't get tired easily. Now that is because my father is like that. I think I've seen my parents, and that's the way we've grown up. That does not mean that I'm bipolar, because I dance, I sing, I like acting, I draw, I do so many things. I like gardening, I like this. That is just my personality. That does not make me bipolar or ADHD or something. All these things have to be diagnosed by a doctor, a medical professional. But what happens is people simply start using this, wrong statements. And so what happens is people are frightened to be diagnosed with any mental ailment. And if they are diagnosed with something, oh my God, my life has become hell. At the same time, if you are diagnosed with cancer or kidney failure or something, it's okay in the sense, I know it is traumatizing, I know it is a physical health, but you have reports to show you can go through chemotherapy, you can go through medication, you can go through anything that is acceptable by society. But if I were to say that I have to go to, what is it called, Dr. Siddharth? Now it's no longer called a shock treatment. It is called something else.
ECT, electroconvulsive therapy.
Yes. Okay, if it is now, I only know it like people say it like shock, like what I've seen in Malayalam movies, like especially there's some movie of Mohanlal and all, a wood piece or metal piece is put in the mouth and he goes and sad music and all that. That's what you think about. At the same time, Bipolar, there was another movie again. So what happens is in the movies, it is all I would say masala, and to get the mass appeal of feeling sad or frightened of mental ailments. Now that has a lot of it creates an image in the minds of people that this is the meaning of bipolar, or this is the meaning, and they get very frightened to bipolar. Okay, that is a kind of a social stigma that is associated. But ECT as such, when I spoke to a psychiatrist, it's not like that. It is not that somebody has a, so if the doctor is recommending something that you need to take an ECT, it is like, okay, it is something, a procedure that you have to go through even today. Because why is this social stigma there? Because people are still going by being Google doctors, reading more about it without having expertise. So you are building a sense of imagination in your mind and you're working upon that, or you are basing it on the movies you have seen. But mental ailments are not what you see in movies. As all of us have experienced mental ailments, we three are here, especially Vijay sir, Gayatri, as well as me. We are here who have openly are admitting that we have been through either bipolar, clinical depression, or whatsoever. We've been through that, and we're sitting here talking to all of you. Okay, there are 40 people. Now I'm saying we're talking to all of you here, not because our life came to a standstill, or we are weak or ashamed to society, or we are disabled for that matter. We had an issue like BP or diabetes, or a heart issue or something like that. We got treated and we are okay, and we are achievers in our fields in society. We have done so much, and today we are strong enough to give back to society, and that is why we are here. So we need to have more conversations. That is what Hari, that I was. We need to have conversations, and more than like we having helplines and all that. I would really, long for a day we have focus groups, like how we have in de-addiction of alcohol and all that. We need to initiate focus groups where in each community or schools, or focus groups, so as per age groups in communities, as per the whatever college or whatever, okay, in departments, that you have focus groups on every Saturday and all that. A focus group should have only maximum of 10 people, and all the 10 should get at least a max of say 5 to 8 minutes to talk, maximum of 8 minutes. We do not want listeners there. If you want to be a listener or audience, it is not allowed. But if you want to talk in a focus group of 10 is there for you. So it is not to speak about, oh, I'm suffering. It is not personal problems of whatever you're going through. But if you have any feeling like, I'm losing my appetite, I don't know, I'm feeling very sad, this happened to me, it is fine. And since then the next time the same focus group meets, they talk about, yeah, after this session, like I was able to make this progress, or I'm not able to go ahead. That is where there will be an expert or a counselor, or somebody who can just facilitate it, who will say that, okay, if you feel that this is not helping you, then you need to seek professional help, and these are the options you have. So if we have focus groups, that would generate more conversations, and like how we are talking to each other, it would make mental health so inclusive, a part of physical health, which is a brain. It's end of the day, everything is connected to the brain. Agreed, Dr. Siddharth? Yeah, the brain is in our physical body. Okay, and the brain generates certain signals, and the mind, it is feelings generated by hormones and brain, it's all here. So it is a part of our physical body. Why do we have to alienate it and taboo one in this? Because if one is not there, the other is not there. And most, even if I have a physical ailment, if mentally, if I'm not strong, I cannot come out of my physical ailment. Right? So mental health needs to get that much priority and more conversations. Thank you, Hari.
Very nice. So like we have a Fit for India campaign, we have a mentally fit India campaign. So this has been a longish conversation, and I suppose it will go on forever. We are already almost 90 minutes into this. So I'd like some closing comments from each of the panelists, starting with Vijay, on how do we see these conversations going forward? Any thoughts on that, or anything else you want to say, Vijay, to close?
Yes, it's been a wonderful experience, Hari, and all my colleagues here on the panel. It will be nice if we can have frequent discussions and frequent conversations. Of course, I can pick up the phone and call Gayatri anytime, Anita anytime, and Mr. Narayan and Dr. Reddy. But a collective conversation, and maybe we can involve some of our friends who have logged in, what they feel. They would also love to share their experiences at some point. But this platform for me is a huge encouragement. And I look forward to having more and more conversations with you all, and especially with Anita and Gayatri, my newest friends.
Wonderful. Very nice. Gayatri, your thoughts?
Yeah, so we are at Anthropy, we're working for, we have a vertical which is called Podcasting for Social Change. And one of the things that one of the podcasts we're working on is on mental health. It's going to be in Hindi, so that a larger, these discussions tend to be relegated to English-speaking audiences. There is a greater vernacular for that. What is the Hindi or the Tamil or Marathi translation or Bengali translation of psychology? I don't think that there are adequate words there. So, to spread the conversation, to get the conversation going in regional languages is going to be important. And the other thing I would really love to see in family setups, the way I must admit that, and I think Vijay sir would have said that as well if he had the chance. My family setup, my father has been really supportive, especially in the last few years. And that makes him the leader of my priority circle, which is really weird because he and I used to butt heads all the time. But I would just say, if we can teach the next generation to that it's okay to not be mentally strong. Just because you look weak, that doesn't mean anything. It's kind of like being mentally strong, being constantly effervescent, being constantly performing for society. That in itself is a huge instigator for a lot of people. That sets them down the path to depression because they don't want to do that. We don't want to be constantly performing. Constantly, yes, okay, smiles plastered on our faces. And so if we can see a greater proliferation of conversations, especially at the family level, we say it's okay to cry. You want space, we're outside your room, we're outside, but where you're never really alone. But take your space, take your time, be reserved, be shy. There's nothing wrong in that. And just as a final note, to that end, there's a lovely Pixar animation 2015 film called Inside Out.
Yes.
And to substantiate, to support my point about finding merit in sadness, that movie defines it. And it's a kid's film.
Right.
Fantastic. So please, if you want to laugh, but you also want to talk about depression, have a look at that film.
Nice. Well said. Your thoughts, Anand, about how we take this initiative forward, conversations?
I think it's a great idea. We must have more conversation, and we should form these focus groups. Fortunately, modern technology and social media helps us in doing this. It's pretty easy to set up. I presume, Anita, you will take a lead in this, and we are more than willing to support.
Wonderful. Dr. Siddharth, your thoughts?
Okay, I would say that we should have more groups like this in the open where several prominent people come forward and give their voices and how they have faced, especially those who have faced mental illness. For example, in 2015, if I am right, Deepika Padukone came forward and saying that I suffered from depression and I went through this. You won't believe that that one statement by her actually, initiated a lot of people to go forward to the psychiatrist. So, in India, basically, Indians went to identify basically with so-called heroes, so-called, champions who have achieved something in their field or what they are, if beat anyone, So if those people like Miss Anita and who has come forward today, it's a very brave thing. Uh, Goes forward rather than psychiatrists or psychologists going, to the public saying that please come, please, take care of yourselves, we are there for you, you don't have to worry for this. It's not something which you have to be afraid of. Someone like Miss Anita, if she can go forward into the public and tell them her own experiences or her own stories, people tend to listen to her more. People tend to, accept it more. Because like Mr. Anita rightly said, like people tend to go to doctors, but when it comes to psychiatrists, they know, like many people, they would take photos with their cardiologist, upload it on Instagram, on Facebook, but when it comes to a psychiatrist, they would like keep them apart. And even if they see their psychiatrist outside in a function, they will say, I don't know who you are, nice to hear you are a psychiatrist or even a psychologist. So rather than us going forward, I would suggest someone very prominent going forward in these focus groups, weekly sessions like this on Zoom, which can reach the general public. That would, encourage them to put the first step forward in getting help. That would be the one of the ways in which we can help them.
Wonderful. And I think Anita is already doing every bit that she can because she's written a book. She's acted and directed in short films. You can check them out on YouTube. They're very nice. The three of them, at least, that I've seen, and all of them dealing with very pertinent subjects that we've discussed today. And I'm sure she's probably taking it out through other forms like dance or drama, theater that she does, and definitely through these conversations. So there's a question from Dr. Farah to Dr. Siddharth. So, Farah, you can.
Yeah, my question is basically I'd been reading and writing about my background is like master's in psychology only. So I was just hearing everybody's perspective. And recently I had the chance to speak to a neurologist who is also helped many mental health patients. So he mentioned one thing that in majority of the cases, they find that mental health issues are strongly genetic in nature. So is to what extent is it true? And he said that also it is highly treatable. That like previously the treatments were not so effective, but now the mental health, most of the mental health issues are very effectively treatable if the diagnosis is correct and everything. So just like we say, no, when it comes to life, when we read of theories related to happiness and other things, we say like there is a set point theory of happiness which says that we are born with a set point theory beyond like if even if great events happen in my life, after a certain point of time I will get used to it and they will cease to hold meaning in my life. I mean, it will not make me continuously very happy. So that is what you call hedonic adaptation that happens with everybody. And similarly, the set point theory also says that, so if my set point is like 40%, I will be happy no matter what, and 60% will be driven by the external environment. If the environment is bad, I will be sad, and so all those things is there. So since you are a doctor and you must be dealing with patients regularly, so my question is, uh, do you see this trend that in most of the cases of mental illness, patients have a genetic aspect element to them, or it can to what extent is it true?
Yeah. If we are talking about pure genetics, it is only in 20 to 30% of the patients where there's pure
Okay.
genetics, where either one of the family members has a strong, history of mental illness. And this type of genetic illnesses, genetic prodromal, is actually mostly restricted to only few mental health illnesses, like mainly schizophrenia, bipolar, and in certain cases of depression. it's actually 20 to 30%. What happens in the rest of the 70 to 80% is that you are actually genetically, it's a mixture of your environmental, social, and your biological factors. If all three of them, start going, undergoing a disturbance, then only you develop a mental illness. Otherwise, let's say if you have you're biologically, you are very good, and you have a good social structure system, and and your environment, it's somewhat disturbance, that does not just mean that you can develop a mental illness. A true mental illness actually can be triggered by a combination of these three. It's not just pure genetics. Pure genetics occurs in only in 20 to 30% of these cases. So rest of the time, it is just social, by interaction of three phenomena: social, biological, and your environmental. Yeah.
I think there should be a very fine line which
Behavioral as
should
well.
differentiate between mental health and mental illness, because mental health is just like physical health. Just like you need to take care of your body, sometimes you feel sad or depressed. Everybody goes through different stages in life, and we just cope with it. And only when that you are not able to cope with it and it takes the form of an illness, it starts disrupting your activities, then probably it falls into the category of mental illness. But the fear of or the phobia associated with a mental illness prevents people probably from talking and
Treatment. Right.
reaching out and treatment.
Okay,
Yes,
there's one last question we'll take
thank you.
from Mr. Benjamin to Dr. Reddy again. What's the difference between being bipolar and being depressed? We'll wind up after that.
Okay.
That's
Bipolar is a pure genetic. If you see, like Miss Farah asked, mental illness and mental health. If you will see the actual scientific, psychiatric, view, mental illness are only two: schizophrenia and bipolar disorder. Now, depression and anxiety are mental health disturbances. Something like, let's say, obesity, which occurs due to the various issues happening around you, and you are not able to cope up, and you experience those. But being bipolar is actually a culmination of two conditions. It's like it's a genetic disorder where you have two phases. One is manic phase, other one is being a depressed phase. Manic phase is a person, he suddenly starts going, extremely happy, talks excessively, starts spending too much money, does a lot of physical activity. There are these people, manic patients, who when undergo, bipolar patients who when go into manic phase, start doing gyms for 8 hours, 10 hours. They start working for 8 hours, 10 hours. And then when that phase subsides, they go into a phase of depression, a true depression, which they would face, biological depression. And if you talk about being depressed, being a true clinical depression is like Miss Anita said, it's like, you feel tired, you have sleep disturbances, and you feel dull, and you don't feel like talking to anyone, you feel hopeless, worthless. The thing about bipolar is that you tend to face a cycle of both mania and depression. But in a true clinical depression, you tend to face only depression. You don't go for that manic phase. And bipolar is a true genetic disorder, which one of the genetic disorders in psychiatry, while depression need not be a genetic disorder. It can happen as a result of your external circumstances. I hope I've answered that question adequately.
Yes, I think very adequately. So we should come to really there's a lot of pressure on all of us, children, adults, old people. There's information overload, there's expectation, there's social media, there's a pandemic on top of it. So clearly we need to handle it all together. There's nothing wrong in seeking help. So as far as the book is concerned, there's a lot of good information given out in the book in a very crisp and succinct manner. So it's a very handy and easy read. I think it's a book everyone should buy and everyone will benefit from. Anita, is it available online, or do we just have to buy it from you? Or?
Yes, I've got dogs barking, just excuse me. The book is available on Amazon as well as Flipkart, and there's also a Kindle version available. So it is accessible for everybody, and the purpose is, I think, it is to bridge the gap between a person going through. It's not only for depression or bipolar or anything like that. It is also for people to understand the difference between mental health and mental ailments, mind disturbances, everything, who you can approach, and once you go through that, how you go through towards a recovery and as well as healing. So that is what it covers. And there's a beautiful poetry at the last of the book.
We come to the end, and thank you everyone for your time. Dr. Siddharth, Anand, Gayatri, Vijay, Anita, everyone else who is logged in. Thank you for a wonderful time.
Thank you.
Thank
you, Hari. Yeah, thank you, Hari, for leading the whole thing. And it's really nice of you to do so. I'm muting myself, the dog.